Hi Acumen followers, this is Diana Strubler here with another recap of this past Monday's blog post. This past Monday, I detailed out one of the 4 categories in the MIPS program, Advancing Care Information, or ACI as I'll shorten it. Starting in 2017, clinicians that are on the MIPS track in the MACRA program will need to submit measures in the ACI category because it'll make up 25% of your MIPS composite score. Now, ACI may be a new term to you, but it's really just our old friend meaningful use with some tweaks. CMS carried over the measures you'll find in the current MU program, but adjusted the rules to make it easier on clinicians. For starters, they removed the all or nothing component of the program. In today's MU world, you either have to meet all of the measures or you fail the entire thing. With ACI, you only have to report the 4 or 5 base measures, but you don't have to report on all of the measures available. Another big difference between ACI and MU is the removal of thresholds. You will no longer have to hit a certain threshold percentage in order to meet a measure. Lastly, ACI removed 2 measures, CPOE and clinical decision support, and also remove the requirement to report on the immunization measure. As I mentioned earlier, in 2017, the ACI component of MIPS will account for 25% of your MIPS composite score. To get the full 25%, a clinician must earn the full 100 points available in this category. The ACI category is broken down into 3 main sections, and each section is allotted a total amount of possible points. The base score is worth 50 points, the performance score is worth up to 90 points, and the bonus point section is worth up to 15 points. Now, if you're good at math, you probably realized the sum of those 3 categories is worth more than 100 points. If you earn more than 100 points, though, you won't receive any extra credit. CMS will cap your points to 100. Now let's cover how you can meet each section of ACI. The first 50 points, aka the base score, can be earned by reporting data on the following 4 or 5 objectives: performing a security risk analysis, e-prescribing, providing patient access to their data, sending summary of care via HIE, and requesting accepting summary of care. This one's only required in 2018 and beyond. Not reporting these base measures will automatically give you 0 points for the entire ACI category. So you, at minimum, want to make sure you report on your base measures. The second ACI section is where you will make decisions on which measures you want to report. The goal here is to earn an additional 50 points. If you do this, you'll get a perfect score in the ACI category. To earn points in this section, you will need to take each percentage-based measure and divide your performance score by 10. This will give you the amount of points you earned per measure. For example, if you got a 90% in secure messaging, you will earn 9 points. All of the percentage-based measures are worth 10 points except for 2 of them. The HIE measure and provide patient access measure are worth up to 20 points each in 2017 only. The immunization measure is not a percentage-based measure, but it's worth up to 10 points as well. If you're sending data to an immunization registry, you'll easily collect those 10 points. Now, if you're still struggling to earn enough points to score well in ACI, you can always try to earn bonus points. Sending data to a syndromic surveillance registry or to a specialized registry can earn you a maximum of 5 bonus points. Another way to earn bonus points is if you use your certified EHR to meet certain clinical practice improvement activities. But I'll save the details of this one for another video. So in summary, you'll need to report on the base measures no matter what. Then you'll need to report on additional measures to earn performance points. You'll also have the opportunity to earn bonus points as well. Now, my words of advice for those preparing for next year is to see which measures you have historically done well in and try to knock those out of the park. If you're a nephrologist who normally opts out of meaningful use by taking a hardship exception, you may want to reconsider that for next year. Taking a hardship in the ACI world means that the ACI category will be reweighted at 0 and your quality category will now be worth 85% of your MIPS score. We'll dig into the details of that one later. For more details on what I covered today, take a look at this week's blog post. Also, keep looking out on our blog because each week until the end of the year, we'll be posting 2 macro blogs, and remember to follow us on Facebook, LinkedIn, and Twitter for our MIPS tips each Tuesday. Until then, happy reading, and we'll talk to you soon.